As a country, we are currently in the fourth stage of the COVID-19 prevention. And the COVID-19 prevention, such kind of stage, means that we have a lot of community transmission. It indicates that we cannot be able to know how many people have been in contact with somebody who has been found to be positive. So that literally means that we have many people who are turning out to be positive, many people who need specialized treatment, and we also have many people who are still undergoing home-based care. Actually, almost 90% of people who are found to be positive are in their homes. They are being taken care of by their families. Now, if you're looking at the cost and the implication to an individual, and the cost to an implication, you're looking at cost and what it implies to a family, you're looking at cost and what it means to the country. It's quite comprehensive in nature. You need to look at a number of things, even beyond the actual service that you may pay for, or a particular drug that you need to buy from a drugstore, from a pharmacy, or from a medical facility. But you look at the cost implication in terms of the mind, in terms of the psychosocial support, in terms of, in other words, there's quite a lot in terms of socioeconomic that we need to look at and address as a country. And even the implication of COVID-19 to individuals and the country, even when it is completely out of the country, there are things that we shall definitely cover after some years. It's very clear that some people have lost jobs, some people's businesses have closed, some people have lost years. Those who went to the education institutions, people have not been able to graduate on time. People have not been able to repeat some classes for years. So the cost to parents, the cost to young people is quite big. And even beyond what technically we may be grappling with as the sector, now we need to have a lot of discussions on what are some of the key concerns we need to look out for currently. Number one, we require to have a lot of family-led discussions. The current phase we are into takes away 90% of the responsibility from government, from health scientists like us, to individuals now. And so the 90% responsibility on the response was on the technical teams last year. It has now transferred to individuals and communities. So for us to be able to get back to our normalcy, people or individuals or communities need to understand this fully, that the health workforce, the health sector, the health scientists, and many more other support staff are providing 10%. In terms of providing technical guidance, in terms of providing care, in terms of... So, but if you look at what somebody requires for them to be able to recover all through, you may spend like say 14 days in the hospital. But the process of recovering out of hospital, the process of being able to engage with people within your home, for them to be able to mentally understand that things are now back to normal, the psychological torture, it's very difficult to cost it. As a public health expert, there are quite a number of things I would advise people to look out for. Number one, there are those health choices we need to make. Health choices in terms of our behaviors, the way we eat, the way we drink, the way we socialize with the people. And of course, because literally what people forget is that lack of money impacts on your health. Mentally, it works on your health. And failure to work on your spending habits, or the decisions you take in spending money, literally, translates into whether you'll have a happier or healthy life or not. And because also from the public health point of view, we are uncertain of the situation in the country. We are currently in our second wave. You never know what may happen in December. We have seen different countries go through different waves, including the developed countries. So people should know that some companies will definitely collapse. There's no doubt about that. So now people need to sit on paper and resort to thinking about how best can we go by the basics in the way we eat, the way we dress, the way we socialize, the places we go to, and how much we spend. It's a concern to us because we know that at the end of the day, that will definitely translate into psychologically or mentally how people think about how to live. We have seen people killing themselves because they are not sure of tomorrow.